Again, on behalf of Ashish Life Science, I am Dr. Amardeep. I welcome all of the participants for this knowledge sharing webinar organized by Ashish Life Science on very important topic, which you guys are already agreed, that is management of colibacillosis in poultry. And for this webinar, I extend my thanks and gratitude to Dr. Ineko, who is from Uganda. And just to introduce about Dr. Ineku. As you guys must be, seeing on the screen, Dr. Ineku is assistant lecturer and veterinary pathologist. He himself holds a, post graduation of veterinary pathology. Since May 2008 till 2014, he was as a teaching assistant in the Department of Veterinary Pathology, Faculty of Veterinary Medicine, Makerere University in Kampala. And now he's working there as assistant lecturer and veterinary pathologist. Also, he has worked with private sector for private service provider and veterinary staff for the National Agriculture Advisory Services in Uganda. Also, he has worked with SCORE Uganda and NUSAF, that was giving specially the training to the farmers, especially for the livestock as well as the poultry production. So doctor has done his degree from the master's degree from Makerere University, which is located in Kampala, Uganda. Also, he did his graduation from the same college. And doctor is giving his continued services to the veterinary profession since long time. And we are feeling fortunate to have him as our speaker to guide him, to guide us on the important topic, that is management of colibacillosis in poultry. So, doctor, again, on behalf of Ashish Life Science and all the participants, I welcome you. And now the stage is yours.
Okay, thank you, Dr. Amadil Athawale. I'm very grateful for this opportunity to talk to the audience about this important topic. I'm grateful for the audience, the members who are present, for sparing this time to listen to this important topic about colibacillosis, which is quite a huge problem to poultry farming. I would say in Uganda and several other sub-Saharan Africa countries where I have visited, especially in Uganda and surrounding countries where poultry is kept under similar systems. I think my colleague has already introduced me. We'll just go straight to our current topic of today, which is management of this disease, colibacillosis. Thank you. Yes, this is our talking points that we're going to have this afternoon. We have overview of colibacillosis, getting to know what this disease is actually. Its epidemiology, that is in terms of how it is occurring in the population, transmissions and then spread, and how prevalent it is. We're also going to know about the clinical presentation, how to recognize this disease by the clinical signs and the necropsy lesions. And we get to know how the disease is diagnosed. We shall have a particular attention to the trends of this disease in Uganda, particularly, and trying to see how it has persisted as a major disease over time, so for several years in the Ugandan poultry farms. We shall have an insight into how this condition is treated, and then its prevention and control in Ugandan context, but I would also say in the sub-Saharan African context, where most of the farming systems are similar, and being tropical environments, how management is almost the same. Yes, what is this disease? Colibacillosis, of course, this is a It's either a localized or a systemic disease of chicken and other birds, which is usually caused by Escherichia coli, which is also called avian pathogenic E. coli. This disease affects all types of poultry and age groups, including even pigeons. It may be a primary disease, but more often it's a secondary disease as more of a spore-imposing infection to some underlying infections in poultry. Or it can occur as infection to underlying immunosuppression and other conditions that depress the birds. This pathogen, which is a gram-negative rod, which is usually a rod with its fimbriae and other structures on its cell wall, is common in most birds. In all birds, I would say even healthy ones, as a normal flora. And many birds, most birds pass it through their fecal matter to the environment, from which other birds get exposed to and get infected. It is a bacteria which is commonly resistant to a number of antibiotics, but yet it's very common because of its ubiquitous occurrence in the environment. The bacteria, as we said, is present in chicken droppings, and their population in the environment increases with the conditions of housing, particularly stocking rate and the design of the house, how it facilitates the clearance and improvement of the airflow in the house. And once the disease occurs, it may present with several syndromes, what we call sometimes coliform syndrome, and which may manifest with several other signs we can see as air-sacchalitis, omphalitis, choleseptemia, salpingitis, arthritis, cellulitis, and cholegranuloma. And we're going to discuss these manifestations one at a time and see how they actually occur. Some are just localized, some may be systemic, and then you can be generalized. Well, this disease actually leads to a number of losses in the house, and the losses usually arise from the mortality caused by this disease, especially in chickhood, where if they have the early infections, survival of chicks many chicks usually die within the first 1 or 2 weeks of life. And there are those which may be infected during growth and lead to suboptimal performance. And of course, the treatment costs associated with this disease are enormous, since this bacteria is ever present in a house if housing conditions are not improved or provided for to the standard of requirements of the bird. And so often, it can also result into contaminations of carcass in the abattoirs or slaughter facilities due to either cellulitis or other infections of the skin and other body parts. Of course, this disease is also categorized as one of those foodborne pathogens that people can get. So it can quickly result into contaminations. So how does this disease occur in environment, get transmitted, and what risks are there to the poultry keepers and to the birds? This pathogen is ubiquitous. That means it is present in intestinal birds and other mammals, and is quickly or most of the times excreted in the environment and can contaminate the spaces where these animals live. And as I said, it's disseminated in the droppings of the birds. And E. coli infections often result from some management failures when hygiene is not observed and when the conditions, several stressors are present in the house, or there are some underlying infections from immunosuppressive states of birds, like infectious basal disease. And as we said earlier, this disease is often secondary. And for that reason, we need to sometimes identify its underlying causes But there may be underlying causes, but this disease quickly comes to complicate the infection and then sometimes worsens the state of health in a flock. So fecal contamination is one important way by which this disease gets transmitted. The contamination may be of feed, so that these other birds may get it, especially if it is the pathogenic strain. But most commonly, it is through the inhalation. If these birds breathe the litter, which is contaminated with already fecal matter, and this bacteria is inhaled in birds that have a lot of dust environment. And then fecal matter also may contaminate eggs, and in that case, during incubation or hatching period, this bacteria may be sucked into the eggs due to cooling and water loss. And then also during the machine incubation, the bacteria may remain in the yolk sac and lead to early infection, the omphalitis. Birds infected by direct contact with dirty litter and hatchers or contaminated shells, these are the common methods. And then this is generally an environmental disease through which the birds get exposed. Bird-to-bird transmission is not a major, it's not a method. It is all the birds get theirs from the environment from which they share with others. Since this is a disease which is from the bacteria which is shared in the environment, and the conditions to which these birds are exposed may result into accumulation of either excessive dust or even generation of ammonia from the house, from accumulated litter or water pouring or leakages, and the ammonia damages the airways. This bacteria ends up proliferating on the respiratory surfaces, worsening the state of the condition. Therefore, housing conditions such as stocking rate, ventilation, light distribution, among others, are major factors that need to be considered while handling this disease. What are the clinical symptoms with which this disease manifests, and what are the lesions associated with them? This disease, of course, we said, may manifest with generalized signs or localized. In most cases, if they are localized, signs may be just non-specific or even mild. But in others, when it's systemic or it's serious, it may affect birds, like these birds which were submitted for diagnosis in our facility. You will see the lesions after were depressed and sick, and most of them had some respiratory noises. But most of these others most of them, when they are sick with systemic disease, they either have ruffled feathers, enlarged and swollen navel in the young, and there's generally decreased appetite. There's marked depression, and lameness is observed in others with arthritis. And then there's diarrhea and pasting of feathers around the vent, particularly whitish diarrhea, especially if there's some form of peritonitis also associated, and adhesions of intestines, which we usually see in this. So when we look at this is a case of some birds that were submitted for us for diagnosis. These are 3 birds with eyes that are all blocked with cheesy white material, and commonly associated with other signs like flu-like signs. When we look at one of these birds, you see the eye is actually swollen, it looks enlarged, and with it, the eye is just blocked completely. Going further, you expose this eye and you try to squeeze out what is inside. You find a cheesy white material which comes out and leaves the eye below. In this case, the bird was, I think I would say, fortunate that the real eyeball was not infected, where I could not see the hypopion. We couldn't see pus in the eyes in this case. But the swabs from this yielded pure culture of E. coli. This, for our context, is commonly being confused with infectious coryza, which is associated with sinusitis. But also, of course, we can see sinusitis in E. coli. But the most common observations we can see in our case here when there's poor light distribution and the related are the conjunctivitis, which is so common, but we does not rule out occurrence. It is not the rule out method for us to say E. coli or colibacillosis should be differentiated from coryza by this. In this particular one, we can see the sinuses are distended and there's a cheesy or matty material blocking the eyelids. This is a form of coryza, but using necropsy alone or clinical symptoms alone may not be sufficient to differentiate this cause of this what's called coryza. Coryza is caused by Bacterium paragallinarum. There's an RV here, which is formerly called Haemophilus paragallinarum, but now it's called Bacterium paragallinarum. The forms of colibacillosis in its manifestation, I'm now bringing from the age of the young one to adulthood and the groups that may be affected. And as you will see, in many cases, that most of the time young birds are more susceptible to this disease, probably because of low immunity yet, but also because of exposures and other playful natures by which there is more dust when they are playing, especially if light distribution and other factors are not well controlled. And for this, we can see scabs in the navel of this bird and looks as a dry scab. And when this is open, we see the yolk sac is actually red and distended. And this is what's called omphalitis. Omphalitis is not entirely from E. coli alone, may occur from other bacteria like Staphylococcus, like Pseudomonas, can also be in Salmonella, and a few other environmental contaminants, but mostly E. coli is the most common cause. They are isolated. Then you also see these chicks. These are 3-day-old chicks with a retained yolk. And the yolk, when we open, the yolk sac is bigger for this age. And this yolk is inflamed with some reddened parts. And this, of course, such birds usually do not survive for long, despite treatments. And of course, if it's a milder one, the treatments may save them in the first week of life. Some survive, but some may still go on to die when there is a problem. And sometimes this yolk sac may adhere to the abdominal wall and result into entrapment of intestines, which we often see. When that occurs, the young bird is usually unthrifty, has poor growth rate, and is most of the times dull. And of course, when these ones, for chicken, we need to have a good growth rate. They should grow faster, and we need to, for broilers, say, food conversion ratio is what is important for us also to determine in profit maximization. So for this disease is one major issue that needs to be controlled at the start. So it can be a hatchery-related issue when eggs are contaminated either at the breeder house or within the hatcheries. The second way by which this disease manifests is these two forms which we are talking about, the cellulitis. Cellulitis is inflammatory lesion of the subcutis, and most of the time it is manifested with the deposition of fibrin. And the most common entry route of the bacteria to this site is by wounds on the skin. And the wound may just be a small pore, which usually results into the contamination of the wound by E. coli, and the body reacts by this fibrin deposition, which we see in this arrow on the left, and this which we are trying to pluck. This is from the bird which was depressed in the image which I displayed earlier, the broiler bird. But then, in addition, this bird, inside when you open, it has diffuse deposition of fibrin covering the surface of the liver. In this case, we call it perihepatitis. And then also the heart, where the heart looks very white, covered with thick white material. And then deep down, of course, in the abdomen, we'll also show you that they have fibrin deposited in the peritoneal cavity and also covering air sacs. This form of cellulitis also again, can be seen in some of the birds that are, these are layer birds in one of the farms we visited. And these birds, I think, were getting trapped in some wires, being pierced by wires in the back region. The lesions were entirely on this region, and most of the times we see, and people say they are, most of them are either misdiagnosed as rat attacks, but I think this is now wounds created, yeah, but infected with bacteria. But in this case, E. coli is a common contaminant, but Staphylococcus and sometimes Clostridium also superimpose or cause infection. In that case, causing what called necrotic dermatitis or gangrenous dermatitis. And below the skin, we can be able to see thick fibrin deposition in this case. And such birds are usually unthrifty, dull, and cannot produce optimally. We can also see in some cases air saccolitis, and we can see thick fibrin deposit on the air sac, particularly on this one on the left lung or covering the left lung, and it's very thick. And we can also see thick fibrin in the peritoneum and also on the caudal air sacs, parts of it. And then generally all the peritoneal cavity is covered. And this particular case plus what I say, this is what called polyserositis, because of multiple serous surfaces being involved in the inflammation by this bacteria. And the bacteria can also, but most of these polyserositis cases are when the bacteria is disseminated throughout the body, particularly through blood. And of course, the dissemination through blood is mostly related to if the infection route is most of them believed to be from the airways, where the bacteria penetrates the air sacs or the respiratory surfaces because of thin blood vessels in the airways, if it is inhaled in, and reaches the blood and is disseminated everywhere. Once it's disseminated, it can result into generalized infections with pericarditis, with polyserositis, and several cases, and sometimes involving even the brain. In that case, encephalitis can be seen with neurological signs that can manifest. But for this one, also in some laying birds, we see that the egg tracts get infected and accumulate fibrinous material, which block the passage of egg tract. Once this occurs, this is a nearly permanent disability to the bird that they cannot be able to lay. And at all costs, producers must prevent this situation from occurring, because this is if it was a mammal, it's like a permanent birth control measure where the passage is already blocked. And that inflammation, salpingitis, is not a good thing. And most of the times it's associated with the degenerate ovarian follicles. And sometimes we see yolk peritonitis also. This is another form of manifestation of colibacillosis. It is more common in colibacillosis than any other bacteria, we would say. And then we also observe this form of still salpingitis. This is a case of a layer, and it's more localized. We can be able to see fibrin in the oviduct, particularly the shell gland. And then on the lower side, we can still see the normal shape of the ovarian follicle. And this is still a bird which is having the infection more localized. And in this case, the bird was dull, but then was not laying. And this bird, once in such a state, we don't expect it to lay because the egg tract is already blocked, and we may not have passage of eggs or development of egg to the end. So we would producers should work hard to avoid such states from occurring. This form of the infection occurs more common in the peak period of production. We see this, most of the farms here in layer birds, we see it from around week 22 to around 33 weeks of age. This is when the infection, the peak period of egg production is setting in. And in that case, the birds begin to, if the environment where they're laying is not adequate, if is not very good, we'll find several birds get infected and do not produce as expected. So this is a disease of laying birds. This form is for laying birds. It should be prevented, and it's more common, as I said, in the peaking period when the egg production is peaking, and it's more. So for that, it is by week 32, we see it common here. I was trying to bring these two. These are two different clinical lesions, manifestations, which we needed to differentiate if we are doing necropsy. Like this left, this polycerositis, which is a wide distribution or diffuse distribution, deposition of fibrin on the perihepatic surface, on the pericardium, and then we also have it on the right side. We all have a deposition of some quite crystalline adherent material on the liver surface, which appears chalky white, quite different from the one on the left. The one on the right, this is visceral gout. Visceral gout in itself is more of a metabolic disease, which arises from a different pathogenesis, possibly kidney failures. But then this polycerositis is typically E. coli infection, colibacillosis. Once we observe this, we are nearly certain that this is a colibacillosis that is there, but it can be secondary to a pre-existing disease or underlying infection. So probably at the end of this, one can be able to recognize the difference in the manifestation of these two syndromes, which possibly cannot be confused when we are for the beginners, but then we need to say how to control. Then we also have this another form of coliform, this E. coli infection, which occurs usually terminally or after a long infection, which is called choligranuloma. When you see nodular manifestations or nodular growth or depositions on the surfaces of intestine, especially serosal surfaces, and this significantly affects absorption of nutrients, and that affects also the way the bird appears clinically, and such a bird is non-productive. Of course, this is one form which usually you differentiate from. We need to differentiate from avian tuberculosis, but this is a form of choligranuloma or E. coli, the chronic form, which is also called Yares disease. And it is one form that once we see this, of course, rare, it is not treatable, it's not helpful, and we need to strategize on how to treat them. The diagnosis of colibacillosis, how is it achieved? And then how do we really say it is only colibacillosis, not underlying disease? But of course, we may have underlying diseases, but if the secondary infection may become more important in causing mortalities or losses than the underlying disease. Say like mild or mesogenic Newcastle disease, once it infects birds and you have secondary infection with E. coli, it is another thing. But in this case, most of the features, clinical syndromes may be of the E. coli, but there may be underlying infections too. So for diagnosis, we say that first by clinical manifestations, we get clinical syndromes, and then we need to do necropsy to describe lesions, and then we need to also do culture of this bacteria and isolate. And in most of the times, if we are to do treatments, sensitivities will be good because this bacteria is often resistant to a number of antibiotics. And actually, it's one stubborn bacteria which needs to be managed with the care. And then, yes, for us to achieve some results. So we collect tissues from the clinical cases, or those that we do necropsy. And then also, we can get swabs, say, from those which have conjunctivitis and others. And then we culture them. And the culture is, of course, we can only determine by that. But what we are able not to do easily or readily is usually to do the serotyping and the determination of the virulence factors. They are not routine procedures that are being done. But for routine diagnosis, mostly the culture and isolation and sometimes sensitivity, most of the time sensitivity. So how, with these diagnosis and manifestations, what are the trends of this disease in Ugandan case? For this case, I'll limit myself to the cases we receive in the lab where I work, where we've had this diagnosis made for some number of years so far. And this disease is among the top 2 diagnosed diseases of chicken in Uganda. Of course, I would say it's the first, followed by coccidiosis, and then other infections that we see. But of course, its diagnosis becomes predominant, probably, but not, it is both primary, as I said, and on a secondary, but it is effects in susceptible bird is actually so much. And over the time, the trend, the pattern of the disease has almost remained similar. And in that, from 2012, when the lab where we've had accumulated a number of data until up to 2014 about the cultures of the samples submitted, E. coli or colibacillosis diagnosis has been one of the top. For example, in this paper published by one of my colleagues, which is of which I was a co-author, colibacillosis topped the list of bacterial diagnoses that were made in between 2012 and 2014. And these are a number of cases. And I need to say that these cases we receive are by the farmers and veterinarians, and they are submitted. Of course, not all cases in the field are submitted to us, but based on the samples we receive, of course, we would say these are these numbers are based on what we receive. Sometimes diagnoses are made in the field, but based on what we get here, those are the figures we get. And then also when we see in this period of 2015, or June to December, of course, we had 131 farmers who had submitted birds in that period. Coccidiosis was top, but also colibacillosis was among the diseases that were diagnosed that time. But of course, helminthiasis says we diagnose it here. It is, of course, whenever I get a few cases, it may be a co-infection and related. But the 2 diseases at that period were colibacillosis and coccidiosis, and we say that these conditions vary by seasons. Then we also had that the period, that's the half a year period also, Jan to June of 2016. Following the patterns from already established in the diagnosis earlier, we still see colibacillosis among the top diseases that are being diagnosed in poultry. And of course, we are here counting individual numbers of farms that have submitted. So 133 farmers submitted birds to us in that period of the diagnosed or confirmed cases where there was either isolation or diagnosis by the different methods. Colibacillosis formed about 14 of the cases, which translates, which is the second most common, which was the most common disease, followed by coccidiosis in that period. And then just bring a year before, the last year we had, where we have now for 1 year period where we had chicken only cases. These are 161 farmers who submitted. The number of poultry farms that have been submitted have been fluctuating over years. Actually, it's just increasing after the COVID lockdown period. Actually, before 2020, 2022, 2023, the numbers were increasing, but 2020, 2021, the poultry production was seriously affected. But still, last year, in this, of the 161 farmers, 37 submissions were diagnosed as colibacillosis. These are based on clinical syndromes, lesions, and then culture results. And of course, the other diseases that were also diagnosed or unconfirmed constituted about 16. But this is the pattern of the disease we have seen over the years. So it really constitutes one of the major problems in our production systems. Now, why is this disease so persistent in this environment or in Uganda? What one can say is that most of our production system is based on depleter system with a lot of hygienic challenges and also observance of the stocking rate and the conditions for rearing and not so much observed. Depleter, of course, we said, is the cheapest system and the most predominant method of keeping birds here. Although we have also seen some cases in cages. Our cages are also not really spared. But in cages also the damage either from the accumulation of ammonia and damaging the airways is one common thing we can say speculate would be predisposing factor for the infection of E. coli or even sometimes for cholera, where the damage of the airways is affected. But colibacillosis remains one of the core infections in that system. These photos below are from one of the house designs we have in the on some poultry farms in Uganda. Of course, the orientation of this house, as you see, the one on the left, which is wooden, which is like low-cost house, is the orientation. This is like the light rays from the in the morning hours, eastern side are able to enter this house, and of course we know when there's a non-uniform distribution of light, it affects also distribution of birds in a house, and that in itself affects the way the birds play or respond, and the waste accumulation in the house also varies. And the same, this same house, the house on the right is another design which is also similar, but then the observance of orientation to light rays and distributions, natural light distributions, seem not to be a common observance of the rules in this environment. And for that, cases of E. coli, I'm not saying directly related to that, but when we see factors that allow an unequal distribution or uneven distribution of birds in a house, the parts where there is a lot of concentration due to light attraction and related may have more contamination, and this disease is common. And for that, this remains one of the major problems. Then this bacteria, of course, we say this is a present in the environment from being discharged from the excreta of the birds. Repeat infections are really common. And of course, usually, as I said, non-observance of appropriate housing design, it remains an issue. Hello? Hello?
We can hear you. We can hear you.
Okay. Yeah, my screen has disappeared.
No, we can see your screen.
Okay, let me get back.
We can very much see your screen.
Okay, I see. Yes. All right, thanks. There was an interruption on my screen by another program. So, non-observance of appropriate housing designs and specifications leads to more reoccurrence, repeated occurrence in these houses. Also, sourcing, of course, what I needed to say is that there are people who are trying to do vaccinations of this. I didn't. The vaccinations, of course, this bacteria being having multiple serotypes, and there's no cross protection. It is not happening. People also do vaccinations, but you see occurrence of this disease in the farms. But I'm not saying that it's directly attributed to these vaccinations. But what I'm trying to say is that many people think by only vaccinating alone, you can leave all factors constant and then the disease will not occur. But they forget that vaccination is not a major way by which we can control this disease because of multiple serotypes for which there's no cross protection from the vaccines. And that alone gives room for a lot of conditions for chances for the disease to occur in the environment. Now, the treatment of this disease, what are the what are the possible treatment options of this? This bacteria, yes, it is one bacteria which is stubborn, but it's also susceptible to a number of antibiotics and can be eliminated by some drugs. And of course, changes in resistance patterns are common. And for that, of course, somebody may need to be, when it is persistent, it would be good for an individual to know exactly which drugs are options to be there. And good enough, when you have a number of alternative chemical groups that are available, you can shift in between depending on the reactions and also the diagnosis you have achieved. And then, of course, this is what we say, when we are treating, of course, we treat the secondary infection, which may be this disease, but also we should not forget to look for the underlying cause so that we will not blame the antibiotics for not working, yet it could have eliminated the bacteria. We need also to diagnose the underlying problem while we do, if this is a secondary one. And then, of course, the common antibiotics or bacterials include the enrofloxacins with these alternatives on the market. And then we have neomycin, we have gentamicin, we have the sulfur drugs that have been proven to be effective also. And then, to some extent, colistin. And we have also other combinations on the market, like doxycycline and neomycin, which is actually, like neomycins have been good in the tests we've seen to be effective against this bacteria on the common strains on this market, on Ugandan environment. So what prevention alternatives or choices do we have for this disease? Of course, given the factors or the many ways by this disease comes in, also different levels of control will be required. Say like at a young age, the early weeks, because that one is usually from the hatcheries or the way chicks are handled. So good hatchery practices and proper chick handling is required to prevent omphalitis, the form that infects the eggs, the yolk sac. Also, proper husbandry practices is required, such as observance of stocking rate. Of course, if we have a high concentration of birds in some areas, that, of course, as we know, these are small-bodied with a high basal metabolic rate. And because of this high rate, they generate waste often. And chicken waste, which we know is excreted, is a mixture of the digestive waste plus the urinary waste. And urinary waste is highly concentrated with ammonia, with urea, uric acid, which can liberate ammonia, which is dangerous. So observation of stocking rate for the flock is very important. Good ventilation and having dry, dust-free litter is very important. Good light distribution. Having uneven light distribution will lead to uneven chicken distribution in a house and giving some inapparent or some apparent overstocking in some areas, which is not right. So we need also to have good litter management generally, of course, to maintain when the litter is very dusty, it should be removed. Of course, one method of removing litter is also equally important. If we remove dusty litter just anyhow without trying to control raising too much dust in the house, we induce disease. Most of the times when people actually remove litter in our environment here, a week or a few days after that, they notice cough or flu-like signs in the birds. So it is more of like in occurrence or in association that is observed. So another method is to remove or promptly remove all dead birds that are seen in a house. And lastly, we need to prevent stress in a house or in handling the birds. And then at the same time, we also need to avoid immunosuppression from diseases like infectious basal disease that usually suppress immunity, and then birds get infected thereafter. Therefore, proper housing is very important among the factors required in controlling this disease. And then we'll just, these others we've already explained before, and I'm just repeating for one more time, like say, why are housing important? This is important for the Ugandan context in the sense that, of course, but people need to recognize that these birds spend their entire life in the house. And many people have already built their houses. And to say that we need to break down a house and do a new one, that is not possible, not easy. I mean, it's also, to some people it's possible, but to many it's not. So the only thing is we need to know how now to navigate around to see how to kind of minimize the risks that can come from this disease, that can predispose to this disease. So why would one emphasize good hygiene and good environment in this particular disease? We already know that this disease is from the fecal matter. So chickens spend their lifetime in this house and excrete, do everything inside, eat, sleep, and excrete indoors. Most of the diseases that affect them actually originate from within. And if somebody has good biosecurity measures to limit entry of disease from outside, the biggest the biggest number of diseases, amount of diseases will now be those that are generated due to hygiene-related factors within the house. So we'll find that they become the biggest factors. And as we've seen, colibacillosis is one of the common diseases reported in our houses. Of course, we see Newcastle disease and other diseases that are introduced from outside, because this disease, Newcastle and other viral diseases may not be, may not easily be
Hello, doctor, we lost you. Hello, everyone. Sorry for this technical glitch. Expecting doctor again, Dr. Ineko will be back. I guess there is some technical glitch. Thank you, everyone, for your presence and showing your patience. Dr. Ineko, can you hear us? Yeah.
Yes, I can hear you. I can hear you.
I guess there was some technical problem at your end.
I think I got a technical problem here, but I can, I see also Hosty. Can you allow me to share? Okay.
Now check, doctor, you check.
Yes, I can share again. I think, yeah, there was a small
Network issue, I guess.
So can you see the screen?
Yeah, we can see the screen now, doctor. Please continue.
All right, thanks. That's slide number 30 down there, which is yeah, about the housing. So what aspects of housing must one consider on to try to control this disease? We need what called a space allowance per bird or stocking rate, ventilation, humidity, temperature control within the house, and lighting distribution in the house, proper litter management, and send biosecurity measures, particularly when we are for people to move from one house to another. These recommendations, stocking rates that are recommended for birds, which I think we shall share with the members later. And what the main thing here is to observe the stocking rate, like where we depend more on the tropics, on the natural ventilation. We need to not overstock, and where we because, you know, most of the houses we have here are the open-sided houses, which require natural ventilation. And so the width of the house and the others are important. And then the number of birds we keep is very important. We have this stocking rate, which was established based on publications or paper the documentations from Ministry of Agriculture and Animal Industry and Fisheries in 2019. And then we have Smith, the tropical agriculturalist. These are the recommendations of importance for broilers is to prevent mostly around week 3 and above. They usually develop that form of polycerositis often. So adjusting the housing size for the number of the birds available from 3 weeks and onwards is one important thing the producers need to observe. And for layers also, we need to observe stocking rate. That is important for just for them to be in. And in addition for layers, we shall also see that preventing salpingitis will also need, for ascending salpingitis, will also need a good nesting space, which I think I'll provide in the next one. But this is also feeding space. This is available for sharing, but now each bird should be accounted for in feeding space as they grow. The bigger they become, the more space they require on a feeding trough. So all these are already established and can be used as a guide, not as a rule, but just to guide as in trying to keep a fair stocking numbers. So the nesting space should be adequate to reduce flow laying and sometimes cannibalism for laying birds. There is a reduced incidence of salpingitis or ascending infection if birds lay in clean nests and nests that are having clean litter and if the nests are enough. Of course, regularly removing broody hens relieves the occupied or congested nesting space from layers which would be chased to lay on floor. That will mean we need to observe regularly to see that all broody hens are removed. And then nest types. When we are using different nest types, of course, we need to observe that the number of nests should be enough for the hens we have at production age. And then the individual nests, of course, are the one which where one bird enters at a time. And we usually recommend one individual nest room for 5 to 6 birds, while for the communal one, 50 to 60 birds can be there based on the dimensions of about a meter by half. So ventilation, or just to raise this, how the ventilation is assured in our environment is either by construction of a short-walled house with allowing air to pass through and the house not being too wide and giving a space between one house and another to allow air to pass through. And ventilation is one most important thing to make sure that these birds do not inhale too much of accumulated dust with the bacterial particles in their systems. And then humidity is also very important in a way. If the house is constructed with good ventilation, the moisture levels in a house can easily be controlled to some extent by this ventilation occurring and will limit the amount of bacteria in air to some extent. And the humidity is a very, of course, the amount of moisture in the environment, but if it is high, it will allow several parasites to survive in the environment, including this bacteria too. So this is one important thing we need to observe in housing design. It's controlled also by the wall design. And then the temperature is also very important in a way that we need to temperature control is important in a way that it affects the bird's behavior, laying the amount of eggs laid, and the high temperatures, of course, with the thick feather affects birds in several ways that they may not lay well. And even if they lay some eggs, most of the eggs actually, if the water evaporates, say, for breeders, hatching is a problem. So temperature control is also mostly done through the wall construction. And if the wall is open-sided and allows air to flow, and the height of the wall is important. Light distribution is one important thing in controlling distribution of birds because birds are attracted to bright light. to some extent. Like several open-sided houses in Uganda have direct light entering the house early morning or late evening, sunset, sunrise. And that allows birds to concentrate in those bright spots and overplay. In such houses, you see persistence of respiratory signs and also swollen eyes as a common feature, but it's not only, it's not the, I will not say it's direct, it's not the only major one, but you see a high levels of high occurrence rates of respiratory diseases in houses which have direct sun rays entering morning or evening hours. So it is one factor that needs to be controlled, as already recommended by several authors and by design, that east-west orientation of a house is very important to control those sun rays in morning and evening. Litter should be dry, but not very dusty, and should be friable. And friable means should not be caked. Caking litter means there's a lot of moisture in it and allows ammonia to be liberated. Ammonia can be liberated. And ammonia damages airways. And that gives chance for bacteria to colonize and grow. And that becomes a problem to the survival of the bird. Respiratory diseases are a serious problem to birds. Of course, litter should be turned often to keep it dry. And all wet spots should be removed promptly to avoid ammonia generation in amounts and then parasite growth in that. This is just an example. It's a guide. It is from the local recommendations. And full walls, which are usually for open-sided walls, which are the common houses we have. Full walls should be on east and west direction to prevent direct light rays in the morning and in the evening. And biosecurity measures are important in limiting carrying maybe pathogenic organisms from one house to another, on the gumboots of workers from one place to another. If we have these pathogenic strains which have become resistant to antibiotics from one room to another, any individual must pass through a disinfectant bath. And this bacteria is sensitive. This bacteria is actually sensitive to several disinfectants. So biosecurity involves cleaning, disinfection, and restriction of entry into some of these rooms. So floor of the house should provide for easy cleaning and disinfection when a problem occurs, or when a house has had persistent infection with these resistant bacteria. So cleaning this house must be properly done when the house is destocked. So wire mesh should be one of the ways to restrict and entry unwanted bird, but this is for generally for other infections. We should enforce biosecurity measures in that method. So in essence, poultry production is profitable. Of course, it would be good to consult qualified animal health workers when we experience challenges, especially if we are producers, or if we have challenges, we need to ask these members to. I'm grateful for this chance, and if there are questions,
Thank you so much, Doctor. Just to make us going through all our pathology knowledge, we refreshed evenly the differential diagnosis. What you have explained to us, it really adds a value to all of us, and I really, on behalf, thanks to you on behalf of all the ALS family as well as the participants for this webinar. I can find there are a few quick questions we can take it off. Like Monica has asked, is sulfur is okay when we can use to treat colibacillosis?
Okay. Okay, let me respond. You'll read for me. Sulfur, yes, Monica, thanks for that question. Yeah, the sulfur combinations, the potentiated sulfonamides, which I see is present, available in this range of products, is, yeah, it's effective for the bacteria, but good when you get the history of treatments in that flock so that you give informed treatment. And as we know, also, of course, depends also on age group for treatment. Sulfurs, we may not use them for laying flocks, but we can use them. Of course, when you have no choice, we still use them. But when we have the choice, like young birds we use also, it is good. Sulfurs are good, to be brief. They are good for colibacillosis.
Yeah. So there is one more question from anonymous attendee that vaccines against colibacillosis are not commonly available in the market. So you have any thought on this one, that what are the probable challenges in development of vaccine? And
Yes,
it's
thanks. Well, we've had maybe that's what one reason one question I'd try to respond to. Vaccine to colibacillosis is not common in our market. At some point, it was there, yes, but as you said, colibacillosis has several serotypes, and of course, the most known are the O1, O2, O78 plus other variable surface antigens. So producing one vaccine for all the serotypes is a very big challenge. So vaccinating with one vaccine, which does not have all the serotypes which are in the field, it's very difficult. So you will actually, vaccinating may not solve this problem that much. Though the vaccines are there, it's only when you collaborate so much with the producers of such products, you know which strains are circulating in your environment, and that's when we can be able to employ or may have specific vaccines. Of course, some people have attempted auto vaccines, but it also has its limitations. Auto vaccines are the ones which they believe, which are collected from the flock with a resistant strain. They try to grow this bacteria, inactivate, and administer to the flock. But still, it is a tedious work, and it needs a lot of collaboration with the manufacturers, I would say.
okay. Thank you, doctor. There is one more question from Ronald, that when we were talking about that the free rearing of birds, so does this mean that the disease occurrence or the colibacillosis will be very less in case of free uh, birds or free ranging birds?
Free ranging birds. In free ranging birds, of course, the exposure of colibacillosis is more when there is an environmental, when they're congested. And yes, in free ranging birds, the disease is also there. Personally, I actually have free ranging birds that I've seen this disease in it, especially when these free ranging birds, where do they sleep? Mostly at night. Where they sleep is where their populations are like more congested to some extent. We also have this disease in free ranging birds. But mostly when the housing conditions where they're sleeping is not appropriate or not providing good ventilation and allows a lot of ammonia to accumulate. Yeah, we see this disease occurring. It's there in free ranging birds also, but especially those that are housed mostly at night. And if the housing is not appropriate.
Yeah, and Mr. Emmanuel, answering to your question, already sir has explained very well that how you can have a differential diagnostic. Evenly, if you have to first consult to the concerned veterinary doctor or the poultry consultant to get the proper diagnosis so that he can give the proper treatment to the birds.
Yeah. Yes.
But can be recommended drug of choice. Doctor, he's asking, I guess there is any drug of choice, especially for the colibacillosis. Already you have mentioned drugs.
I would say drug of choice for colibacillosis really depends on the flock history, which we are there. If the flocks are not being exposed, of course, we said, yeah, there are a number of choices we'll have. You can have the sulfur drugs. You can have the neomycin. We have the combination of doxycycline, neomycin, and all that. You still have those as choices, but the best would usually be good to have a diagnosis. If you have access to a lab, it will be good to do culture and know which one is very effective to have.
Yeah, thank you, doctor. How important is drinking water in the transmission of the disease or maintenance of colibacillosis? And what sort of precautionary measures we can, recommend with respect to drinking water to control colibacillosis?
Yeah, sulfur are good. And then other products on market. Even enrofloxacin we've seen has been good.
Okay. What about drinking water? How we can maintain, the cleanliness of drinking water to avoid colibacillosis? Is there any importance of drinking water in transmission of disease?
Yeah, the importance of drinking water, yes, can be a source of the disease, right? The contamination, yes. But the entry route of the pathogen into the body, of course, is another, we say the airways. But then, how do we maintain good quality drinking water? This is depending on the source of the water. Is it from what's your source of water? Is it tap water, well, and related? They are common. There are several. If you need to have a hygienic water, of course, you want to improve the sanitation of the hygiene of your water. There are several water treatment agents on market. The chlorine is available, or other products, even other substances are available. But to say improving the quality, hygiene of water, of course, first protect the water source, limit access of water source from animals and other things, or waste of other birds. And then, of course, limit exposure, particularly from the respiratory route, more than the digestive route, because this bacteria is very common in the digestive system. It's ever present nearly. So unless it is the one which is already resistant and pathogenic, the one which can easily penetrate through. But otherwise, even the healthy bird has this bacteria present in their fecal matter. So the airway, the ventilation route, the congestion, and the other forms of exposure are quite important. But water hygiene is easy. Protect the source, disinfect, sanitize the water by chlorine and other substances available.
Doctor, if I'm so sorry, but there is some confusion that people want, some clarification or how to distinguish between infectious coryza and colibacillosis. Can you just brief on that, or with the help of the slide, if you can go back?
Okay, let me try to get back.
That will be of great help.
Okay, so this is the one which we say is due to infectious coryza, which previously called Haemophilus paragallinerum. It is a disease of semi-mature to adult birds. It spreads very quickly and mostly affects the respiratory system with sinuses, which are heavily infiltrated with the exudate, which is usually sticky. These exudates come from down through the ducts to the conjunctival space, and usually form cheesy sulfur yellow pigment. As I said earlier, using this lesion alone may be difficult, but in most of these birds, you'll find this one spreads very, very fast. Apart from just the lesions, infectious coryza is highly explosive in congested birds. That's birds that are very close to each other, where they are breathing nearly into each other's space, because it's bird-to-bird transmission. While for E. coli, each one gets its bacteria from the environment. So in this particular one, where it is just conjunctival sac involved, so you find a cheesy white material, which is just covering the eye. When you try to open it, you see the bird